Hello. My name is Serena, and I am doing my presentation on communication in the nursing field. I have always had a passion for nursing. My mom has worked in the hospital my whole life as a pharmacy technician, which introduced me to the hospital setting just through personal experience with myself and family members. I've always been intrigued by nurses and the care and compassion they offer their clients, and their patients, and I would love to offer the same thing and just make a difference in the world. I feel like it would be something that would make my family proud, and I would love to work in a hospital with my mom one day. I interviewed two nurses, the first one being Nurse Cleo. She was born in the Philippines and actually became a nurse out there. But in 2009, she moved to the United States and took a series of classes to get her nursing certification out here. She's an, a home health nurse, meaning that she works inside people's homes. And she works with advanced home health. She also became a nurse just to be successful and support her family out here in the States and back home. The second nurse that I interviewed is Nurse Charmaine. We actually went to school together back in middle school, and I've watched her journey to become a nurse, and it's just really inspirational. She just got her associate's degree in nursing, was able to take the nursing test, become a nurse. She's now a nurse supervisor pursuing her bachelor's degree in nursing. And she was motivated after her daughter was born premature. Her daughter had to be in the hospital for 32 days, and she said that the NICU nurses offered so much care and support in keeping her daughter alive that it motivated her to want to be a nurse as well. And I think her daughter is like almost 13 now. So it's definitely a great story. So there's so many skills in terms of communication that need to be used in nursing, but these five seem to be shared between both nurses. And that's to listen, be empathetic, to have clear and concise verbal communication, to pay attention to nonverbal communication, and also to have patience. So the first skill is to listen. And DeVito in our textbook would say that listening is the most important of all interpersonal communication skills. And we learned early on that listening is giving one's attention to a sound or a message. And there's many steps to it. It requires receiving, understanding the information, remembering what you're hearing, evaluating it, and then responding. And effective listening, objective listening, and active listening are all important factors that are involved with the skill of listening. We'll touch upon objective listening the next slide, but effective listening will consist of having both non-judgmental and critical responses. Listening is always a prerequisite to offer some kind of help. So you really can't offer useful help to a patient if you're not listening to what they say the problems are. And active listening would consist of just paying attention and nodding your head when someone's talking to you, not scrolling through my phone and being rude if someone is talking, so that they know they have my undivided attention and feel comfortable being open with me. The next skill would be empathy. And being empathetic makes patients feel safe. It also changes the perspective of the nurse. And as I mentioned in the last slide, objective listening is used a lot when practicing empathy, because it's a type of listening that is used to listen to what it would be used to listen to what a patient has to say while being objective. And it lets you be open and empathetic. And excuse me, Bro, I had a brain fart. So it allows you to be more open and not just non-judgmental, so that you can really receive the information that's being given to you. And Nurse Charmaine has a lot of empathy when it comes to nursing because of her own experiences with her premature daughter. And perception checking is a strategy to help us monitor our reactions to people and communication. So if there is a thought in my mind that someone is upset with me or not responding to me or something like that, perception checking has a 3-step process where you describe the behavior and situation, think of possible interpretations of why they're responding the way they are or not responding, and just verify by asking questions for clarification. This can go with patients, this can go for family or friends. It's just a good way from not being so reactive when I'm assuming something is wrong or I'm not getting the response that I expected. So next skill, I guess you can say, would be to have clear and concise verbal communication. Nursing has a teamwork ethic of reciprocal interdependence. We learned about that in lectures 13 and 14. And, Nurse Cleo works in her patients' homes. Even if you're the only nurse assigned on that shift, it's still so important to have clear and concise verbal communication with your patients. Let them know when you're leaving and someone else is coming, and to talk to them to see if, they need to use the restroom, or, if you're helping someone take a shower, you want to be able to let them know, okay, I'm lifting you up now. Okay, I'm going to wash your back. It's just helps people be more comfortable. And it's so important to communicate clearly with the other nurses so that they know you guys can be on the same page about medications, food, bathing, or whatever is on the patient's itinerary. And there's also the concept of principle of dialogue. That's essential because with patients, you have to use all 3 steps that pertain to principle of dialogue, which are to respond, ask questions, and also to stay on topic. Sometimes maybe a patient is starting to ramble on, and really you need to just respond to their initial symptoms or questions or problems, and ask questions to see if you can figure out how that happened, or to maybe just figure out what direction you need to go in terms of diagnosis, and just help them stay on topic so that you guys can find that diagnosis as quick as possible. And when it comes to communicating with coworkers, Nurse Charmaine would say to have clear online professional communication, and that it is so important. Unfortunately, communication is absolutely critical when becoming a nurse. Everything she said has to be reported or endorsed to the next nurse, your charge nurse, desk nurse, your doctor. Something like a fever can be overlooked, but if you have a patient that has an internal IV and they have a fever, that could be a symptom of sepsis, and there could be a infection. And so giving them Tylenol won't help that. They would need antibiotics. And she said, unfortunately, they had a patient die because one of the nurses failed to communicate a code blue. And that's just really the worst situation that could ever happen. So next skill, sorry if that was a little downer, is to pay attention to non-vocal and non-verbal communication. We learned in the very beginning in lecture 1 about the different modes of communications, and non-verbal, non-vocal were a set, I guess you can say. And we sometimes patients lie about symptoms because they're scared they're going to get themselves or a loved one in trouble. Maybe a woman came in with injuries and doesn't want to admit that she's experiencing domestic violence, or maybe a young teen came in with symptoms that are severe, but they don't want to admit they took drugs because they don't want their parents to get mad. So you have to really look for kinesics, body movements and body language. Look for communication apprehension, where, maybe they're feeling nervous and they don't want to talk. So maybe you need to get them by themselves to make them feel comfortable, or initiate small talk to make the child want to open up more comfortably. Notice facial movements, expressions, emotions, being happy, being sad, or maybe look for fear in their face. So it's very important, both nurses said, to just pay attention to your patient's nonverbal communication. And lastly would be patience. It's important to have patience with your patients. Oftentimes, clients need another perspective. Patients need another perspective to improve their health. Everyone has different lifestyles and are familiar with the resources they've been given in life. And sometimes it requires negotiation to help a client want to adjust their lifestyle, whether it's adjusting how you're eating, stop smoking, or just whatever course of action that needs to be taken. Uh, Sometimes it's a little hard to deal with clients that are just so different. So, Nurse Cleo would say that it's important to stay away from perception and stereotypes, and practicing patience helps that. Because even if a drunk homeless person comes in, they have to be treated fairly, and you can't judge anybody based on stereotypes, because everybody deserves honest and safe healthcare. And Charmaine explained that practicing patience on coworkers is so important. We learned in lectures 9 and 10 upon different types of conflict and how to manage it. Outcome conflict is when people disagree about a preferred outcome or end state. And gosh, nurses and doctors, she said, disagree about diagnoses and courses of action all the time. So it really requires collaboration and patience with each other to hear everybody's point of view and do what's best for the patient. And again, a collaboration would consist of where everybody gets what they need in some way, shape, or form, which is client, healthy patient. And it also helps build teamwork skills. All right, so that about that does it. These are my citations. I appreciate you listening to my presentation. And yeah, have a great day.